1. Primary dentition period is? Answer: C. From 6 months to 6 years. 2. Which teeth the proximal aspect shows rhomboidal appearance? Answer: B. Mandibular posteriors. 3. If a mandibular canine has bifurcated roots, they are most commonly placed? Answer: B. Facial and lingual. 4. Position and movement of articular disc of TMJ is controlled by fibers of? Answer: D. Upper head of lateral pterygoid muscle. 5. The two major fossa of permanent maxillary first molar? Answer: B. Central and distal fossa. 6. Posterior embrasures are generally larger on the lingual than on the facial, with the contact area within the facial moiety, except between maxillary. Answer: D. First molar and second premolar. 7. In which of the following a nonfunctional cusp is present? Answer: A. Maxillary first molar. 8. Number of teeth seen on X-ray at birth? Answer: C. 24. 9. Which of the following muscles moves the condyle and articular disc anterior and downwards on glenoid fossa? Answer: A. Lateral pterygoid. 10. Which muscle is responsible for translation of condyle? Answer: D. Lateral pterygoid. 11. Depression of mandible is achieved by? Answer: D. All of the above. 12. On which of the following permanent teeth is it most difficult to distinguish between mesial and distal aspects? Answer: B. Mandibular central incisor. 13. Protective crests of contour on buccal and lingual surfaces are found? Answer: D. Both A and C. 14. All are true about calciotraumatic line, except? Answer: B. Due to death of odontoblastic layer. 15. Kalu, a 6-year-old child, received tetracycline. Noticeable discoloration will be seen in? Answer: C. Canines, premolars A and D2 and D molars. 16. Desmodont is another name for? Answer: C. Periodontal ligament. 17. The last primary tooth to be replaced by a permanent tooth is usually the? Answer: C. Maxillary canine. 18. Maxillary first molar has how many roots? Answer: B. 1 lingual and 2 facial. 19. The occlusal surface shape of a 3-cusped mandibular second premolar? Answer: C. Square. 20. As compared to permanent tooth, root formation in primary tooth? Answer: A. Take less time. 21. The term diffidont means? Answer: C. 2 separate sets of dentition. 22. The geometric outline of the buccal surface of posterior teeth are? Answer: A. Trapezoidal. 23. Using occlusal morphology as guide, the mandibular third molar is most similar to? Answer: C. Mandibular permanent second molar. 24. An anxious parent calls you that her 5-month-old child has still no teeth in his mouth, then you should? Answer: B. Tell her that it is normal at this age. 25. When a molar has no opposing tooth, it can become? Answer: A. Extruded. 26. The shape of the occlusal surface of the permanent maxillary first molar is? Answer: D. Rhomboidal. 27. The premolar with the occlusal groove pattern that may simulate the letter Y is? Answer: C. Mandibular second. 28. the most common sequence of eruption of the permanent maxillary teeth in children is? Answer: C61243578. 29. What is the functional form of anterior teeth from the mesial or the distal aspect? Answer: D. wedge-shaped. 30. Distibuccal cusp of 27 falls into? Answer: A. embrasure of 37 and 38. 31. The primary lateral incisors begin to calcify about the? Answer: C. 41/2 month in utero. 32. At birth the following teeth are calcifying? Answer: A. primary incisors and first molar. 33. The first permanent tooth to erupt in the oral cavity is the? Answer: B. mandibular first molar. 34. Cusp of Carbelli is present on surface of the permanent maxillary molar? Answer: D. mesial half of the palatal surface. 35. Palato-gingival groove is found in? Answer: A. maxillary lateral incisor. 36. Which of the following tooth shows largest messiobuccal ridge? Answer: A. maxillary first premolar. 37. The root of maxillary lateral incisors if curved is usually in which direction? Answer: A. distal. 38. Which cusp is poorly developed in a permanent maxillary second molar? Answer: B. DL. 39. 5 cusps are present in? Answer: C. maxillary and mandibular first molar. 40. Which of the following movement are performed by a non-working condyle? Answer: B. downwards, forwards and lateral. 41. Average of length of maxillary cuspid is? Answer: A. 26 mm. 42. Which of the following is true about calcification of teeth? Answer: A. calcification of primary teeth is almost complete at time of birth. 43. Calcification of all teeth except last molars are completed by? Answer: D. 8 years. 44. The mesial contact R of the permanent canine is at the? Answer: 45. Forward movement of mandible is done by? Answer: A. lateral pterygoid. 46. Calcification of permanent first molar usually begins in the? Answer: C. at birth. 47. What is the amount of time required by erupting premolar to move through 1 mm of bone as measured on a bite wing radiograph? Answer: B. 4 to 5 months. 48. Which of the following has a non-functional cusp? Answer: C. mandibular first premolar. 49. Articular disc of TMJ receives insertion from which muscle? Answer: B. lateral pterygoid. 50. Which of the following has the maximum faciolingual diameter of the crown? Answer: A. deciduous maxillary second molar.